Hi, I'm Dr. George Lee. Sometimes people call me Dr. G. So I am a urologist. Clearly, I deal with men and children with sexual organ issues and also urological organ issues. Ladies and gentlemen, today is going to discuss issues with swollen testicles, right? Obviously, testicle itself should really be normal size, equal in sizes, and then suddenly it becomes swollen. It can be due to a few things. Of course, we're not going to talk about cancer at this stage, but we're going to talk about several conditions that can cause testicular swelling. The most common testicular swelling actually is accumulation of fluid, okay? If you're imagine that the testicle itself actually swimming in a layer of fluid so that it can move freely, right? And then that layer is called tunica vaginalis, and then so that testicle can actually move quite freely. However, sometimes your body accumulates excess fluid that actually just retain around there. Or you have a bit of infection, or you have a bit of trauma, a bit of bleeding that accumulates a lot of fluid around the testicle. So the testicle becomes quite swollen and you can't feel your own testicle yourself. It's because the testicle is bathing inside this fluid. It's a condition called hydrocele. In medicine, we always teach a medical student how to make that diagnosis. In my days, when I went to medical school, there were no ultrasound scans. So we use a condition called, an examination called translumination, right? Okay, sounds like some movies that, is about kind of like lighting up Christmas tree or something like that. It is really as simple as that. You imagine that if your testicle is surrounded by excess amount of fluid, and then that testicular surface is stretched. So in order to see whether the light is reflected when you shine some light on it, then you choose a dark room and you put a torch on the testicle itself, the whole testicle will light up like a lantern. And that is what we call translumination positive. And under that circumstance, this is a testicle that has a condition called hydrocele. Another fluid accumulation is called epididymal cyst. The epididymis is usually a place where the sperms mature prior to ejaculations. And the production itself, sometimes if you don't ejaculate, and then the excess amount of sperms just get accumulated in there and change into fluid. And this looks like little bits of pearls in there. And when you do an ultrasound scan, it's like a bunch of grapes. And for your information, you don't really need to worry about this because it can never turn cancerous. It can be occasionally uncomfortable, but mostly seamless comfortable. So if you have epididymal cyst, which is very common, it happens to like 20% of populations across the world, and then don't worry about it. If you're worried, just get a simple ultrasound scan. It will confirm the diagnosis. So the other two types of testicular swelling, one is called the inguinal hernia. So imagine, I mentioned earlier on that the testicle bring the blood supply and the spermatic cord all the way from the body down to the scrotum. When it brought that, it needs to go through a channel, and that channel is called inguinal canal. So when someone put on weight or they took a lot of straining trying to train their six packs, that canal becomes weakened and your abdominal content will drop into this hole, and it's a condition called hernia. Inguinal hernia is very common, and some people live with the hernia without any issues. However, if the hernia is causing you discomfort, or the hernia is intermittently causing some piece of abdominal content to get strangulated, then you need to get it repaired. It's a very simple condition, simple operation that can repair inguinal hernia. You don't really need to take any medicine because there's no medicine that can resolve this. And the last thing that I'm going to talk about, a benign testicular problem, is an infection. There are lots of studies to show that younger men get infection in the testicle might be because of naughty behavior, right? Okay, the naughty behavior, generally, I mean sexually transmitted infections. And the commonest infections that can result in testicular infections, such as epididymal orchitis, are gonorrhea, chlamydia, ureaplasma, mycoplasma, and trichomonas. And all these are contracted during vaginal penetration, anal penetration, or oral sex. So Sometimes I get clients come to see me and then they have discharge coming out of nowhere. The Cantonese always call it lao bak chok. It's disgusting. Then you can tell that they actually had sex with the wrong people, but they deny it. They always say it's the dirty toilet or something. Whatever it is, treat the patient with right antibiotics, prove that it's gone, hopefully it will solve their problem, and they know never to let it happen again. Another side of the coin, if a guy is above 40 years old, then it's not necessarily sexually transmitted infection. So it can be because of prostate, because our prostate gets bigger with age. And that enlargement will restrain the urine from flowing forward and always give you a residual urine. And that residual urine always is more prone to infection. And that infection can somewhat get tracked down to your testicle and result in testicular swelling called epididymal orchitis. The more important thing is that sometimes GP treats a patient with short course of antibiotics for about 5 to 7 days. But I know that vast majority of these people, that is grossly insufficient and may result in prolonged treatment up to 6 weeks. So, gentlemen or ladies, now you know all the things that can go wrong in the scrotum. The next time you see a lopsided big testicle, then you know whether to shine the light on it to see whether there's any fluid on it. Okay, signing off for Dr. G.
If you like our channel, please like, share, and subscribe.